Hi, I'm Attracta from Attracta Beauty, and I'm here today with Dr. Daniel Sister, who is a leading pioneering doctor in Platelet Rich Plasma Therapy treatment. Dr. Sister, can you explain more to me what PRP, also known obviously as Platelet Rich Plasma, is, and how is it good for the skin?
Platelet rich plasma means that in a small volume of plasma you have a high concentration of platelets.
Right.
Those platelets, when activated, will release 300 growth factors acting on a lot of different things. They will work on vascularization, better vascularization of the skin, meaning better oxygenation and better drainage.
Yeah.
Very good for dark circle under the eyes.
Okay. Which a lot of people are concerned about.
Other growth factor will work on the bone resorption. As we age,
yes,
we lose bone structure around the eyes, bone structure on the jawline, which is not as defined. The eyes are more sunken.
Yes. As a consequence of gravity.
Yes.
Yes.
Other growth factor will work on the muscle and ligament on the face. Those who are getting looser or tighter, like the crow's feet or the platysmaping.
Yeah.
Other growth factor will work to maintain the fat where it's supposed to be.
So what is the growth factors? If you could explain just a little to my followers.
Growth factors are hard to explain. Let's say just like hormones, they just give a signal to do something.
Yeah.
So for example, you have the epidermal growth factor.
Okay.
With a name like that, it's easy to understand that it will work on the epidermis.
Epidermis, which is
the layer,
the second layer
of the skin.
Yeah.
You have the transforming growth factor with working on vascularization.
Okay.
You have the insulin-like growth factor, there is different type, who will work also on the bone structure.
Okay.
So they don't do anything by themselves, but they force the body to do what it was supposed to do. In a sense,
so it stimulates.
In a sense, it's almost like pre-stem cells.
Okay.
Don't do anything, force the body to do something.
Yeah.
It works very well for receding gums.
Receding gums, okay.
It works to maintain the fat where it should be.
Yes.
It works for dark circle under the eyes.
Yeah.
And the fat is very important because the aging process.
Yes.
We lose bone structure.
Okay.
We lose fat.
Yeah.
Muscle are getting not as good quality as they were before.
Yeah.
And the skin is getting thinner with more lines.
Okay.
Why? Because the volume we had with the fat create tension.
Yes.
That tension is essential to the moisture of the face, of the skin.
Okay.
We lose that volume,
there
is less tension.
Okay.
Less tension, body is creating less hydration of the face.
Okay.
With the PRP, we work on all those factors. The bone resorption, the volume, the muscle, and the skin.
So a minute, am I correct to suggest that it is stimulating and rejuvenating?
It's the most rejuvenating, regenerating, whatever. It is the most complete treatment
for
the skin.
Using one's own blood.
Totally.
Yeah.
Totally safe. It's the patient's plasma, nothing added, and it works on all the different factors.
Okay, and it's correct that you take a syringe of blood from the patient?
Yes, just as much as we would take for a blood test.
Okay.
And within 10 minutes, it's ready to be re-injected right away.
Right into the skin area. And what makes you different from what my research is how you inject and what level that you inject to. That's what makes you stand out as an expert with
I think
PRP.
so. Because, as I say, we are losing bone structure, so we have to inject as deep, as close to the bone as possible for the growth factors working on the osteoblast, the cell for the bone, to work.
Yeah.
And then we work on the muscles, or you have to inject intramuscular.
Yes.
Then you want the epidermis, then you have to inject more superficially.
Yes. Okay.
So it's a combination of 3 different levels.
Yes.
To get the growth factors to work on the bone, on the fat, on the muscle, on the vascularization, and on the skin.
And can I ask, is it only doctors that can perform this treatment? or should it be only doctor?
Should.
Just when I listen to you, when you talk about the 3 different layers, I certainly would not want to be having my face injected if somebody did not know the anatomy and physiology
So,
of this.
technically speaking, I would say yes. I have no problem with dentists
Okay,
because, by definition, they learn the face anatomy.
yes, yeah,
And even though I would say they know the face anatomy better than most doctors.
right, yes, yeah.
So, I have no problem with that. A beauty therapist injecting would bother me.
Yeah,
When I do trainings, and I do trainings every month,
yeah,
we don't accept beauty therapists.
yeah. I can understand that. Because you're injecting, and you could be injecting into a vein, you could be injecting into a capillary.
It's not a problem because you use plasma of the patient.
Okay.
So even if you inject it into a vein,
Okay.
you just put back in the patient what just came out of the patient.
Okay, right, okay. Yeah, but still I would
So
prefer
there's
to
no
have,
risk,
yes,
basically.
but I would certainly prefer.
But where would they inject? How would they inject? How much would they inject? How would they prepare it?
Yes, yes. And there is
If
a
I may stop you, it's like cooking.
Mm.
You go to a good restaurant
Yeah,
and you go to a fast food joint, the steak will not be the same.
yes, no, I agree. Yes, if I were to have this treatment, I definitely would be wanting a qualified expert and a doctor, ideally.
Someone who knows what he's doing,
Yes,
knows why he's doing it,
yes,
knows what product he's injecting.
yes. But also, if I were to have a treatment like this, and that I can go back and that you are aware, you mean of potential, or rather, is there any complications from having PRP?
No, there isn't any.
Oh, that's good.
Over 30,000 medical studies published so far,
Yes,
1 case of infection
yes,
was described.
yeah.
And with a germ that normally you never find on the skin.
Mm-hmm.
So it's
It's
totally
very safe. Okay, very safe.
Again, it's very safe if you use a correct procedure.
Yes.
If you drop the needle on the floor and
No,
you
of
still
course,
use it,
absolutely. Yeah.
that's
No,
a different story.
Yeah, absolutely. Well, that's negligence. Whoever
Yeah.
has that. Can I ask? And this is a question that I get asked a lot. Is the skin around the eye thinner than the rest of the body?
Yes,
It
definitely.
is, yeah.
If you, well, everybody knows that if they pinch the skin, different places, it will not have the same consistency. There is almost nothing. There is no fat under.
Yeah.
Here you have a fat layer under
Yes.
the skin. There is nothing under the eye. There are a lot of capillaries.
Okay.
The skin is much thinner,
Yeah.
and that would lead me to maybe your next question. Eye cream. People
Yes,
complaining,
I was gonna
oh,
ask
I
you.
have puffy eyes. Never use eye cream at night.
Okay.
Why? Because the skin here is much thinner.
Yeah.
Usually eye cream are quite thick.
Yeah.
And again, usually nobody sleeps like that. They turn on the pillow, on the sheet,
Yes.
therefore the skin can't breathe.
Okay. Yeah.
So you have a thick
Layer.
cream
Which could
thick
potentially
layer.
be clogging the skin.
clogging the skin,
Yeah.
like a bandage.
Yes.
You have the sheet or the pillow,
Yeah.
and they wake up with puffy eyes. Not most, but a lot of the patients, they come to see me with puffy eyes, ask for a treatment. I say,
Yeah.
first, don't put any eye cream at night,
Yeah.
and come back in 2 weeks, we'll see.
Mm.
And most of the time, there is no need for any other treatment.
Yeah. Well, I'm very sure you're aware that obviously since social media, people have become, the general public have become so much more knowledgeable in reference to skincare and adapting good skincare routines. The reason I'm asking these questions of you, a qualified expert in the field with skin, is do you think that we, the public, could be using maybe too many products on our skin?
Definitely,
Okay.
definitely. Marketing is king.
Yeah.
Marketing rules everything. As a little story on the side.
Yeah.
When we started to do, when I say we, the clinic, when we started to do the treatment with the plasma,
Yes.
as an internal joke,
Mm.
we call it Dracula.
Right.
Because we take blood skin rejuvenation.
Yes.
So between us, it was called Dracula.
Yeah.
One day, a journalist was in the waiting room.
Mm-hmm.
She heard us talking about Dracula.
Right. Okay. So it's a good
What
sign.
are you talking about? Blood rejuvenation.
Yeah.
She's the one who wrote the first article, and she called it Dracula Therapy.
Right.
Okay? When we saw that in the press, it was like, oh my God.
Yeah. I personally don't like that word.
Oh my God.
Yeah.
Fine. What we didn't know,
Yeah.
that the article came out at the same time as the Twilight movie.
Okay.
900,000 hits on Google in 2 weeks.
Okay. Right. So people got.
That's the marketing.
Yes. No. Absolutely. The power of marketing.
Power
Yeah.
of marketing. Now, skincare. You see all those wonderful Photoshop
Yes.
photos of perfect skin, glowing skin,
Mm-hmm.
radiant, whatever.
Yeah. But it's photoshopped.
It's Photoshop.
Yeah.
And even if it's not,
Mm.
how old are those people?
Yeah.
You don't see a grandmother or an older lady who used to smoke and be in the sun
Yeah.
without any protection. In those years, people were putting olive oil on their skin and
Yes.
aluminium foil under to get even
Anything
more
to get
burn,
that tan.
and smoking at the same time.
Yes.
Those people, they don't have the same skin.
Yeah.
They don't use or they don't need the same product
Yeah.
as a teenager or a 20 years old with a perfect skin.
Yeah.
Marketing wants you to buy a pre-treatment, a treatment, a post-treatment, could be a moisturizer, a day cream, a night cream, whatever. You don't need all that.
What is your best advice to maintain healthy skin?
Well, healthy lifestyle to start with,
Yeah.
that's obviously. And as in everything, less is more.
Yeah, I'm a big believer of that.
Less is more.
Yeah.
And again, just taking the example of moisturizer.
Yeah.
Young girl, they don't use moisturizer.
Mm.
And they have a very nice skin
Yeah.
with a perfect moisture.
Yeah.
As soon as they start using moisturizer, their body stops producing its own moisture
Mm-hmm.
and they have to keep on using it.
Yeah.
Men, they shave,
Yes.
meaning they aggress the skin all the time.
Mm-hmm.
Some of them put aftershave, alcoholic aftershave,
Yeah.
more aggression.
Yes, on the skin. Yes, because
They don't use moisturizer
Yeah.
and they don't need it.
Yeah.
As soon as someone starts to use it, they will have to keep using
Using
it.
it. Yeah.
So less is better.
More. Yeah, because I know a lot of people do want to use moisturizers and certainly SPF. Are you?
SPF is a different story.
Yes.
That is definitely big yes.
Yes. Yeah. Do you think we could be with a lot of chemical peels and products that are causing peeling at home, that we could be maybe using too many products such as microneedling at
Yes,
home?
microneedling,
Is there
retinoic acid, people use to buy it or on the internet.
Yeah.
And they don't know what concentration, they don't know how many times a week,
Yeah.
a month they should use it. They tend to use it every day.
Yeah.
Oh, it's good for the skin. No, it's not good for the skin.
Mm.
It's good for the skin on a specific regimen.
Mm.
Vitamin C is good for the skin. Vitamin C is a good antioxidant. Yes.
Yes.
As long as you don't open the jar.
Yes.
Then it oxidizes and there's no more vitamin C.
Yeah.
Microneedling, derma roller, derma pen, derma stamp, whatever
Has to be done
tool.
with experts.
Yes, but again, you aggress the skin,
Yeah.
hoping that it will react
Yeah.
by making more collagen.
Yeah.
But they don't go deep enough to get a real
At
collagen.
home. At home. Yeah.
Yeah, well, a medical one is a different
Yes, absolutely.
thing. Done by a dermatologist or someone who's trained to do it, it's a different issue. But you can buy all those things online. You were mentioning the internet before, where they have all those demonstration of all those products and what they should do and videos and YouTube and stuff. Internet is good and very bad at the same time. You have the good and what you shouldn't do.
Yes. Well, that's why I do these interviews, because I really want to always give information from experts who have been practicing and in the field for a long time to see over a period of time what works and what doesn't work, rather than looking for the quick fix.
You just think that all those cosmetic products, there's a new one coming like every day.
Yes, yeah.
If the previous one worked, why would you need to change it?
Yes. Yes,
If
absolutely.
it's not broken, don't
Yeah.
fix it. If you have a product you're happy with and it helps your skin,
Yes.
why would you change it because you saw a new ad?
Yeah. Well, this is my concern in reference to what I feel that the beauty industry is very on the cusp and in many ways is in fast beauty, in the sense of that there's so many products coming out or so many treatments coming out that maybe we're overstimulating our skin, that we don't know what is working or what is or what isn't, and perhaps all of this kind of like multi-pharmacy of treatments could be actually aging our skin.
It
rather
does.
than
It does, because you clog the pore.
Yeah.
The skin is not breathing naturally. You don't help the vascularization.
Yeah.
You don't have the drainage.
Yes.
You add layers of different products, one on top of the other. You don't even know if you need them.
Or if what is working or what is
Or if it's
not
working.
Yes, yeah.
Or
I know in your website you have written, we can't stop time, but we can slow it down.
Definitely.
And
Time, age is just a notion.
yeah,
But nothing should stop anyone at whatever age, biological,
Yeah.
chronological age,
yes,
to do whatever they want.
yeah.
Yes, they won't run as fast as when they were 20. They won't lift as heavy weight as when they were 20.
Yes, yeah.
They may not be as perky in the morning if they don't sleep at night.
Yeah,
Doesn't mean they can't do anything.
yes.
Doesn't mean they have to stop doing anything.
Yeah.
It doesn't mean that they have to stop looking for new clothes and trying to look their best.
Well, I'm a huge believer in age as a number.
Yes.
And I think it's very important sometimes not actually to tell anybody your age, for the very reason that it limits. And sometimes it limits yourself. When
It
you
limits
think,
yourself.
Yeah, because
does.
if you do not put a number to your age, then you're just who you are. You're not being limited. Or like, I have to wear this cream now because I'm in my 30s or my 40s or my 50s. So for me, I feel age should be ageless.
Age is just a number.
It is.
Doesn't mean anything.
Yes, absolutely.
Doesn't mean anything.
Yeah. And that is what I believe as well.
Emilia Eckert, how old was she when she tried to fly all over the world?
Yes, exactly. Yes.
So
I think when you put an age on something or somebody, you limit them.
yes.
As in you are limiting their own expectations for themselves.
And they are limiting themselves.
Yeah, but that
Which
is
is
what I
worse.
feel is great about the beauty industry at the moment, that we are having these conversations where it's liberating. I think actually the beauty industry at
It
this
is.
moment is liberating,
And if I may say,
with good education.
if you look at the whole medical sphere, every department makes some progress in the past 10, 20 years.
Yeah.
Some.
Yes.
Some better treatment for cancer, some better treatment for whatever. We don't have many new antibiotics that works. We don't have new treatment for high blood pressure. We don't have new treatment for a lot of things. The cosmetic or aesthetic medical industry, there's something new coming all the time.
Absolutely.
It's the fastest evolving
Yes.
sector in medicine.
Yes.
We can do now non-invasive treatment or minimally invasive treatment.
Yeah.
That is totally different, and we don't need as much
Yes.
surgery as we needed before.
In 2012, it was the first time that I met Dr. Sister. It was at the College of Surgeons. You were part of a debate, and the question at the debate was, is the knife and scalpel a step too far? And that was in 2012.
Yes.
But I would say at this moment in time,
It
it's
is.
all about the the minimal invasive
Yes.
and the needle, rather than products are one thing, but in many ways it's now people are looking more for that advanced step into skincare.
Yes, because people
routine.
want less downtime,
Yeah,
less invasive procedure,
yes.
less expensive procedure.
Mm-hmm.
And you have, for example, just as an example, someone who's not happy with his or her nose.
Yeah.
They want to have a nose job.
Mm-hmm.
Fine. If they have it done surgically,
Yeah.
it's good or it's not good, that's
Yes.
a different story.
Yeah.
Fine. But if it's good, it's good. But maybe it will be good in the eye of the surgeon,
Yes,
but not good in the eye of the patient.
okay.
Now we can do nose correction,
Mm-hmm.
either with filler or with thread lift.
Yeah.
Fine. So we correct the nose.
Yeah.
And then we know it's not going to be forever, but it's like a test run.
Mm-hmm.
Oh, I like it. Next time I will go for surgery because I know exactly how it will look and what I want.
Mm-hmm.
Oh, no, I don't really like it. And I won't go for surgery.
Yeah.
Before, it was surgery or nothing,
Yeah.
and if the surgery was not what the patient wanted, too bad.
Mm-hmm.
Now we can do test run.
Yes. Yeah. But is it difficult at times to say no to your patient who you see is coming in maybe every 3-4 weeks looking for a treatment?
No,
In your professional-
it's not difficult.
Yeah.
It's not difficult. It is difficult if you do the work for the money. It's not
Yeah.
difficult if you
Yeah.
do the work for the pleasure you are having at doing it.
Yes. Yeah. Do you get enjoyment of the
Yes.
stay? Yeah.
And I like to argue with people say, no, I won't do it.
Yeah.
People think, oh, he's rude or his bedside manner. No. If I don't think that will give the result,
Mm-hmm.
the expected result,
Yeah.
or a good result, I would say, no, I won't do it.
Well, I think it's exceptionally important that the relationship between the doctor and the patient is based on trust. And I think you have to build that upon that for the patient.
I have a patient who came not long ago. He said, I want more filler in my cheekbones.
Mm.
I said, no, you don't need more filler in your cheekbone. In fact,
Yes.
you need less volume in your cheekbones.
Yeah.
But I want it. I
Mm.
said, but I don't care. If you want it,
Yeah.
I will not do it.
Yeah.
If you want to do it, other doctors.
Mm.
Well, the previous doctor injected 7 syringes.
Mm.
I say, fine, go back to him.
Yes.
I
Yeah,
will
no,
not do it.
I think it's exceptionally important
But-
now.
3 weeks later, she came back and said, you were right.
Yes, exactly. Yeah. Well, that's the type of doctor, if I ever go under the needle or knife, I want that type of doctor, I want that answer to be given to me because it's for the benefit.
It's for the patient. We are
Of
not
me.
doing
Yeah,
work for ourselves.
yes.
We do it for the patient.
Mm-hmm.
I remember when I was working in Dublin,
Mm-hmm.
and it was very interesting to see how people react in different countries. Botulinum toxin, they want it only for the crow's feet.
Yeah,
Front line, forehead, they don't mind.
no,
Don't want line here.
yes.
That's all.
Yeah, I call them laughter lines.
Yeah,
I
but
don't like
you,
the word
you
crow's feet.
cross, you go to
Yeah.
London or to Paris.
Yes.
No, I don't want those lines. I don't want my
Yeah.
forehead.
Mm.
Different countries, different expectation,
Yes,
And
absolutely.
we
Of
all-
beauty.
different beauty, and
Yes.
we all have to react for the patient, not for us.
Yeah,
As I told you, Caucasian,
yeah,
Asian,
yes,
African,
yes.
they don't have the same
Well,
bone structure.
we've all got different, yes, facial structure, absolutely.
Different facial
And but it's
structure.
appreciated, I think,
It's not the same curve.
yes,
It's not the same volume on lips.
yes,
It's not the same fold on the eyes.
yeah,
You don't do the same work,
mm-hmm.
or we shouldn't do the same work
Yes.
on all those different patients.
And that's what I would say, a great aesthetic doctor, I feel, has to have an artistic eye to not be afraid to look at the face rather than injecting in points that you've been trained to. You have to look at the face. It's the same as me as a makeup artist. I have to look and study the face to just, and getting into these central facial triangle.
Yes, again,
Yeah,
when we're young
we've got that heart shape.
and when we're older,
It becomes more, well, because
it's still a triangle, but not the,
Yes.
not the same
it's
one.
the reversion of a triangle.
Not the same one.
Yeah,
And the curve,
the
the
OG
OG
curve. Yeah,
depend on your cheekbones.
yes, yeah,
The triangle is due to gravity and the fat,
yes.
moving
But
down.
you can improve that.
but that all that could be improved.
Yes, you can help to
And-
improve that. Yeah,
Both sides of the face,
yeah,
because we are not symmetrical, most of us,
yes,
and we sleep more on one side than the other.
yes.
So one side may end up with small lines and flatter than the other side.
Mhm.
So if you do a work, it won't be the same thing.
Yes,
All templates that are given by labs,
yeah,
chemical manufacturer or whatever, they're useless.
yes. Well, I would hope they are, but
They're
I
totally
sincerely hope.
useless because
Yes.
a patient is not a template on the computer.
No, absolutely not. And everybody's face is different. And I think it's also whether anybody who's working on the skin or the face has to have the confidence to
Not-
be able to
Not
study
only
the face.
everybody's face is different,
Yeah.
but both sides of the face are different.
Yes, yes,
And as we advance
yes,
on time,
yeah,
there will be even more difference
yeah. As we get, you mean as we age?
as we age.
Yes.
But that's advance on time.
Yes, as we age, yes.
The season
Mm-hmm.
is very bright.
Yeah,
We're going to frown more. We're
Yeah.
going to squint more.
yeah,
It's grey and raining.
yeah.
We're not going to use our muscle the
Exactly.
same way.
So it's more seasonal.
So seasonal,
Yeah,
age,
yes,
time,
yeah,
both sides of the face,
yes.
genetic,
Mm-hmm.
what kind of products they're using,
Yeah.
what kind of food they're eating,
Mm-hmm.
are they drinking enough? Drink, drink, drink.
Yeah. Is water good?
Yes,
Yes, good. That's, you've heard it here from Dr.
Yes.
Sister.
my wife is fighting with me because she
Yes.
thinks I don't drink enough water.
Yeah,
All those different little things.
And
it's like a
sleep.
puzzle.
And sleep. Yeah.
But that's
I think people sometimes underestimate how
yeah.
valuable sleep is.
But all those little parts is
Yes,
like a puzzle, and you need all them to,
combined.
Fit.
Yes.
and then
Mm-hmm.
you have a strong bonding.
Okay, Dr. Sister, I'm going to bring this interview to the close, and I would like, if possible, that you can give me 3-5 tips
Drink.
for healthy aging, healthy, positive aging.
So, A, don't mention your age to anyone.
Good.
Nobody cares about that.
Tick.
Tick, yes. People are jealous in general,
Mm-hmm.
so don't give them any weapon.
Okay.
Don't mention your age.
Right.
Drink
Water.
water, yes. Well, you can have a glass of wine,
Yes.
not a bottle of wine.
Yes.
Sun protection factor,
Yeah. 30 or 50?
50.
50. Factor 50.
And what nobody does correctly, reapply it.
Yes. Yes.
It's
People
not
do forget that. Yeah.
It's not because you put it at 8 o'clock in the morning
Yeah.
that at 4 o'clock in the afternoon you
Yeah.
are protected.
How
You are not.
frequently? 4 times?
3, 4
4
hours.
times. Yes. Okay.
Yeah. I know nobody wants to remove the makeup, put the sunscreen, reapply the makeup.
Yeah. But it is important if
It
you
is-
want to have
it is
beautiful skin.
important. Sleep,
Yeah.
as you say.
Yeah.
Rest. Good food, good
Yes.
hygiene.
Yeah.
What you're eating. And be careful with the cosmetic product.
Mm.
Less is more.
Less is more. You've heard it here.
And you don't need to go for the most expensive one.
Yes, yes. Well, thank you very, very much for imparting all of your wisdom
My pleasure.
and expertise.